you're the Executive Director of Brain and Mind Institute, but you're also a Commissioner on the National Mental Health Commission.
That's correct.
Were you surprised at how long it took the government to release the report you guys put out?
Yes, we're surprised.
Yeah.
Because there was an orderly process with the government.
Yes.
The government had agreed before the last election that rather than going to a larger review process like a Productivity Commission review,
yes.
And I say that because the issues in mental health are very complex. They run across health, social services, welfare, education, etc. That just like the review that happened in aged care, there's a need to rethink really how the whole sector is structured and financed. It's not simple Commonwealth state health funding as it's often presented. It's much more complex.
Yes.
You know, the system needs to work as a whole. So people like Alan Fells, the chairman of the National Commission, you know, feel that the area really requires fundamental rethinking from a finance point of view. And I say Alan's been associated with those things, but also been associated with things like the development of the National Disability Insurance Scheme. Sometimes you've got to really rethink the system.
Exactly.
Otherwise, you just get the same result.
Yes.
And we've had, I say that also because we've had national mental health reform in Australia for over 20 years. We've had national plans for over 20 years, since 1993. So we've had governments, both state and federal, actually committed. We've had many good political leaders right back into the Keating years, through the Howard years, certainly had a bump there in the Rudd period, but the Gillard years, and at a state level, we've had many state premiers who are actually very strong on these issues.
Yes.
But we haven't really changed the system. And I must say, sadly, in my own lifetime, I've been associated with a series of human rights, you know, national reviews, inquiries with government and with non-government organisations, which largely, if you walk out on the street and ask people their experience today, many situations, it's very sadly, is somewhat worse than it was a decade ago from their point of view, that on many of the key issues that we prioritised then, which included early intervention, better acute services, dealing with comorbidity with alcohol and physical health problems. Many of those key groups feel that we've actually, despite the increasing public expectation, increased commitment of government, big commitment under the Howard Yemma deal with COAG in 2006, bigger commitment by Julia Gillard, that on the ground we're finding progress. So Tony Abbott, actually having been health minister, was quite aware of this. Said, look, let's not have a productivity commission review, fundamental, because that's a long and complex process. We've got a national commission, why don't we use it? So Peter Dutton oversaw an orderly process to take a year to report back to the Commonwealth on Commonwealth programs, because they can control those things.
Right.
And I made the comment in the article, many of the big reforms that have really achieved anything in mental health have been Commonwealth funded. So, and they've had big, you know, they've been very significant in development. So, and that was agreed, and that was to go into delivered to the government by November 30 last year, so that could enter into budget speculation, budget planning for 2015, and you would get action during this term of government, in the first term of this Abbott government. So it was a very orderly process, and the Commission did its job. It sought many specialised inputs into that. It also had over 2,000 submissions. You know, in other words, it rounded up the experts, it got in the key groups, it put those issues in. Very significantly, it tried to align mental health with health, a critical, as asked by the Commonwealth, a critical eye over the programs it currently looks at and the way they're organised and whether they fit or don't fit such an approach. All done, delivered to the Minister November 30th. Now,
and not released until it was leaked in April.
Right, and put the Commission somewhat on the back foot. So very unfortunately in this area of key health and social policy, we've got stuck in a machinery of government issues. So I don't think that's allowed the Commission to explain some of its more controversial aspects. For example, I think misreported that it simply wants to pull money out of hospitals, which is not true. It wants to devote growth funding in health expenditure preferentially to the non-hospital sector. Because we have many reports, some of which are not in the public domain, that we have more than enough hospital beds in Australia in mental health, but we also need to not use hospital beds for housing and accommodation and social services. Very expensive way to put a roof over our head, and a less preferable way to other communities, step up, step down, other sorts of residential facilities and community support of other types. So this left the Commission having trouble explaining some key aspects out of context of the report. And I think very much prioritising regional delivery, effective primary care, some really key issues like the development of medical homes for people with complex physical health and mental health problems as real ways forward and departures from the simplistic kind of approaches we've had of constantly trying to tinker with a fundamentally broken system in our current areas. And, you know, I think, if I reach over on my desk, it's a very large report, 700 pages.
Yes.
For anyone who ever wants to actually, you know, there's a template. There's a template in there of what to do on every page. You know, we don't need to revisit this. We need to do things. But the unfortunate response that we've got is it'll need to be reviewed by reviewers. And it's missed the 2015 budgetary period. You know, essentially in the machinery of government, immediately leading to discussions about 2016, which runs the danger of no implementation during this period of it. And we can't afford 3 years of no action in the mental health area. And this is the tragedy of mental health, a constant stop-start, you know, and then we have royal commissions and inquiries and coroners and healthcare quality issues. We go, oh, you know, we're back where we started, rather than one of continuous improvement. Well, another key structural change is the commission I'm on in the Gillard period sat under Prime Minister and Cabinet.
Right.
Now, that allowed it to actually look across social services, welfare, health. And our best friends in mental health are in finance and treasury.
Yes.
We are productivity people. You know, we are the biggest single area that accounts for health-related disability in this country.
Yeah.
So what the Commission report emphasises on like page 2 is the Commonwealth already spends $10 billion a year in this area, but $6 billion of that is effectively in welfare and carer support type situations, and only like $4 billion is effectively in healthcare.
Yeah.
So what it's saying, and then when it was saying that, it was saying it through a whole of government and financial and social participation perspective.
Right.
When we got moved back into health, which is something that the Abbott government did, we're now on, after a long line, because we all know what matters in health: cancer care, hospitals, emergency departments, diabetes, MBS items, PBS items, the pharmacy agreement, you know, all that. And everyone goes, mental health. Oh, well, that's hard. Look, that's a bit complex, and it's a very difficult industry because it's not just in health, it's in social services and housing and education. Go, yes. Having been moved back there, the danger is, and it's always been the case in mental health, go to mental health funding in services, mental health funding in research, it's way down the end of the health agenda.
Yes. It's
way up the top of the social agenda. Actually, we always know when there's an election on. It's very senior people come to talk to us. Because it always catches governments out. There's been no election campaign now for a decade, and no leader for a decade who hasn't said mental health's really important. In fact, Tony Abbott was really smart in 2010, actually picking up the early intervention agenda, saying he would put $1.5 billion into Pat McGorry's programs in early intervention, at the time when the Labor Party couldn't organise 15 programs to add up to $200 million, which Julia Gillard was very embarrassed about. And actually, when she was subsequently re-elected, she then actually got on and established the National Commission and committed to a 10-year process and put $2.5 billion into mental health in the following budget. You know, so it's a really serious issue because at the community level, in fact, really serious issues that matter at the community level. So we know when there's an election on because people come to talk to us. When we go back to health between elections, we're down the end of the corridor, way after those guys in suits doing PBS, cancer care, hospital administration, and the worst bit, federal state planning. You know, I think that's the problem that we have. It's very difficult, unless the government had a health minister who was proceeding in a considered fashion in this area, that got lost with the change of ministers. But the danger is also it gets lost in healthcare. It's not lost at the community level. The trouble we have is we've got a template for action, done all the work. I think the feeling is this time the Commission is, our general feeling is the Commission's actually done a really good job. And I must say, great credit to Alan Fells as the chair and David Butt as the CEO to get it all together. You know, what they don't want it to become is one of those white papers or reviews that sits there and goes, oh, that was a little hard on the day to digest those 700 pages. And then they don't want it to be a bad episode of Yes Minister, where it goes off to a department who then hires 20 other, you know, experts to wander through going, oh, Minister, you'd have to be brave. Those 12 suicide prevention trials. It challenges, the report itself is quite challenging to the professionals and to the professional groups. It values It values general practice.
Yep.
It values other areas like the Aboriginal medical services. It values the role, particularly of mental health nurses. It prioritises the youth of healthcare teams,
Yes.
something we really struggle to fund and support in Australia. And it also goes hard on issues the MJA has run on equity.
Yeah.
No, you do not get a fair deal in Australia.
No.
If you're rural and regional Australia, you're a lower socioeconomic group, you're from certain other disadvantaged groups, you get a raw deal.
Yeah.
But lots of Australians miss out for no good reasons. And that requires fundamental system reform. You've got to actually get beyond page 2 of the report and go for the totality of what's being talked about. And the template for action is there. We could be having 12 suicide, not trials, but implementation, much like the NDIS in rural and regional Australia. We've got the systems, we know we need to do it regionally and track it. We could be supporting the mental health nurses program. We could be supporting the enhancements in the Aboriginal program and engagement of pharmacists. We could be supporting the medical homes, where this physical health of people with mental illness is such an issue.
Yes.
We're supporting that integrated care sort of sets of issues. There are issues right now the Commonwealth could act on and sort out. They've got to face the reality, we waste a lot of money.
Yeah.
And we don't use money effectively. Using an $800 hospital bed to provide a night, to provide accommodation, you know, it's incredibly wasteful. If, as has been well documented, about 30% of our acute admissions do not have a clinical crisis, they have a housing crisis. They have no home. If we don't have general practice integrated, if we don't have psychology integrated, we don't need another provider on every street corner of every separate part of the mental health discipline. But that's what we're getting under current MBS items. You can have all the different people all operating independently. It's very wasteful. You know, Australia has big innovations in e-health technologies, in our early intervention services, etc. You know, we've got the makings of the best things. But sometimes you've got to move from the experiment to the systematic implementation.
Yes.
And that requires grown-up government, but it also requires the professions, I think, and I think the MJA has done a fabulous job over the years of leadership about these issues. And if it isn't working, then we have to be honest about that and go back and say, look, it's not that individual practitioners are not trying hard. The systems they work in do not deliver for this kind of complex care. And like a lot of other health, it sits in a social context. You know, so if you're not working with families, you're not working with welfare, you're not working with employment, you're not working with housing, you won't get good outcomes. You can't just look out of the hospital doors and see how it is. You know, mental health is a really fundamental part of healthcare, but healthcare itself is more than just individual clinics and individual doctors and individual health practitioners. And I think mental health, for many of us, emphasises that. And I think the issue is, but we do look forward to serious action in the period of this first Abbott government.
Terrific. That sounds like a great place to stop.
Thank you.
Thank you for your time, Professor.
Thank you so much for bothering to keep